Taking care of healthcare workers is an intentional part of the day-to-day business of being in healthcare. People need to be taken care of who take care of other people, especially when they're pushed as far as they can go. So we have to always be very sensitive to get there first and tell them they're respected, appreciated, and understood. In COVID, we experienced a brand new episode for most of the people who have been in this career for many, many years, where we had always paid attention to the staff. Staff care became about half of everyone's job. We obviously all experienced new levels of separation, and a lot of the staff didn't do well with those environments at first. We actually have created a lot of programs out of that hard environment that we are calling normal today. We have what's called a code Lavender. Whenever a staff or a department experiences a uniquely traumatizing event, after the clinical part of it is taken care of, that staff is still traumatized. So we actually create environments to care for them. We also have special ways where they can break and have counseling. And then we also do what's called a code kindness, which is specifically an intervention that is facilitated by a chaplain, where they take a unit aside and debrief in a way that is healing.
I am extremely proud to work for St. Luke's Health in that our staff really rose to the occasion. When you talk about being committed to community and being committed to the mission of a health system, we saw that every day in the faces of our staff and their commitment to serving a vulnerable patient population.
It was a matter of helping staff to reconnect with their reasons why they were willing to put up with the longer hours, the more critical environments. If you stayed doing healthcare during COVID, you're there because it's a vocation and a calling.
We have just an amazing recruitment team that are out in the community. They're out at our academic partners, collaborating, holding events, wherever we need to be to attract talent. Equally, if not more important, is the retention of our workforce. If you want to learn new skills, you want to enhance your education, we offer tuition reimbursement for our team members. Our team members have opportunities to participate in wellness activities that we have throughout our health system.
Listening to Our Voices is a video series produced by St. Luke's that aims to lift the voices of our employees across our entire division.
We wanted a way to share the likenesses as well as the unique elements of our staff and employees.
We're all different. We all have different backgrounds. We have different cultures. We have different ideas, opinions, everything. But our uniqueness is what I believe allows us to be able to come together and make such a dynamic impact.
Not until we become one can we actually be a transformative presence, be agents of healing. It has to be done in unity.
Projects like this are very important because it really forces us to think outside of just the clinical aspect of medicine. It serves a lot of purposes for giving our employees the space and the platform to really be heard.
We want staff to feel like their voice matters. It relates to St. Luke's mission because it fosters that human kindness aspect of our mission. It's human stories told by real people. You get a little peek into their heart and their souls a little bit and feel that connection between people.
We want to connect with our communities as well, and we hope these stories resonate with them in the environments in which they work and live.
We're in the top 10 states in the United States. And so when you think about that large patient population that we have an opportunity to serve, that provides increased needs for healthcare team members as well.
Healthcare industry is the #1 employer, employing 350,000 people in the Houston region. It also brings in about 5% of our GDP. Using our economic model, we did some forecasting of jobs and GDP out to the year 2036. And what we saw is that our current rate of growth, we can expect 1 in 6 jobs added in our economy will be in the healthcare sector by that time, and that's going to drive about $63 billion of GDP. If we don't address our workforce issues, that's going to shave off about 150,000 jobs and $14 billion from that number.
Within the last 2 years of the pandemic, over 100,000 registered nurses left the workforce due to stress, early retirement, and burnout in general. Foreign-born healthcare workers have always been needed over the past couple of decades. The pandemic took the demand to another level. One of the greatest challenges that any foreign worker faces in coming to the United States is most definitely the process of immigration. So the ability for our government to be amicable, specifically to healthcare workers, will be the essence to our success moving forward. When it comes to their academic background and everything that they've struggled and had to learn to get here, there's no question that these people are extremely well prepared for what the U.S. economy is going to require of them moving forward.
Investment in our healthcare industry and the health of Houstonians is critical to realizing our potential as a city and our prosperity for our city. We're all dependent on having good doctors, nurses, and medical technicians to keep us healthy.
One of the things we believe as sort of an ontology of thought about who we are as a culture is if we take care of our community, then we are better people. After we've experienced COVID now, what we're doing is pretty much institutionalizing or hardwiring the processes of taking care of people better.
I know I work for a health system that cares about its people, who recognize that emotional well-being is equally as important as the physical well-being of our team members.
It's important to us, it's sacred to us to not turn anyone away on whatever terms we get them. That never changed. Even when all of the things of COVID tried to press in on it and do it in different ways, that stayed the same. I think what's resulted from COVID is that we have steeled ourselves in a very healthy way to be useful to a community that needs us.